Future nurses, let's talk about cystic fibrosis, okay? This is one of the genetic disorders NCLEX don't play with, so stay with me, okay? And as always, I have NCLEX review on cystic fibrosis on my YouTube channel at Scrub and Spoon. Go review it. Now, let's go. Now, cystic fibrosis, CF, is a genetic disorder that affects the exocrine glands. These lead to thick, sticky mucus to build up, clog, and impair lung function and digestive system function. It can also affect other organs like liver, pancreas, and reproductive system. Now let's break it further. Let's talk about the exocrine glands. What is their function? Exocrine glands help to produce and move secretions through the organ ducts. Secretions like tears, saliva, enzymes, and sweat. Now in CF, exocrine glands, which normally produce watery fluids, now start producing thick, sticky mucus or secretions that blocks or clogs the organ duct. So instead of the thin, watery fluids or secretions being produced by the exocrine glands, it's replaced with the thick, sticky mucus in patients with CF. Okay? Now let's talk about signs and symptoms in CF. Now, respiratory symptoms you will see, signs and symptoms you will see: wheezing, coughing, dyspnea, and this is because thick, sticky mucus build up in the lungs and will impair the airway. Patients may have sinus infection, barrel-shaped chest, clubbing of fingers and toes, and also chronic respiratory infections. Okay, let's move to gastrointestinal signs and symptoms. Patients may have steatorrhea, that is fatty, foul-smelling stool. Patients may have poor weight gain, failure to thrive in infants, deficiency in fat-soluble vitamins such as vitamin A, D, E, and K. Okay? Other signs and symptoms include salty, tasting skin. Parents may notice this when they kiss the skin of their baby and they feel salty taste. So they report that to the healthcare provider. Okay? Male CF patients may have infertility issues. That is infertility in men that have CF, because of the thick, sticky mucus. Now, let's talk about treatment options for CF. I need you to know that this cannot be cured, but the treatment focuses on managing the signs and symptoms and slowing down the progression. Now, the first treatment we'll talk about is mucolytics. Example of mucolytics like Donase alpha. Now, what are mucolytics? They help to break down or thin the respiratory mucus or secretions, so it is easy to cough them or expel them out. That's the function of mucolytics. Now, the next treatment is inhaled bronchodilators, right? They help to open the airway, and this will lead to improved air exchange, improved gas exchange, okay? And example of bronchodilators they can use is albuterol. Also, bronchodilator is used 30 to 1 hour before chest physiotherapy. The next treatment is antibiotics for pulmonary infection. This helps to prevent and treat respiratory bacteria and infections. Okay. And the next treatment is corticosteroids. This helps to decrease inflammation in the airway. Also, anticholinergics can be used. This helps to decrease new mucus production from the airway glands. Okay. So those are respiratory treatment or management options. Let's go to gastrointestinal treatment or management. Now, patients will be put on pancreatic enzymes replacement therapy. This is because the thick, sticky mucus will block or clog the pancreas duct from secreting the pancreatic enzymes such as lipase, amylase, protease, because these enzymes are responsible or help to digest and absorb our food. So there will be insufficiency in these pancreatic enzymes. So that's why we need to replace the missing enzymes, okay? And the pancreatic enzymes will be taken as whole or sprinkled on their meal or snacks. This will help them to digest and absorb the food nutrients, to digest the food and absorb nutrients that is in the food, okay? Now, this is NCLEX worthy. Diet modification will be recommended by the doctor. High fat, high calories diets will be recommended. Also, fat soluble vitamin supplements will be initiated for CF patients, and fat soluble vitamins like I've mentioned, like vitamin A, D, E, and K. Also, fluids is encouraged in CF patients, increased fluids, because fluids help to thin the mucus and it is easy to expel it or cough it out. So increased fluids in CF patients. Lastly, chest physiotherapy is always used in CF patients. This is the use of percussion, vibration, postural drainage, and breathing exercise to loosen mucus or secretions and prevent it from blocking the airway. It also helps to reduce the risk of pneumonia and atelectasis, which is the collapse of the lungs. And lastly, chest physiotherapy improves gas exchange. And remember, like I said, bronchodilators are used 32 an hour before chest physiotherapy. So to remember this, NCLEX wording, it's always confusing nursing students that which goes first. To remember this, bronchodilator goes first before chest physiotherapy. So remember BP, bronchodilator before physiotherapy. I hope you are good. Now let's go to diagnostic test of CF. The first one is sweat chloride test. Now, a patient's sweat is analyzed to measure the amount of salt in it, right? If the salt level or amount is less than 30, there is no diagnosis of CF. But if the salt level or the chloride level is greater than 60, CF is diagnosed, which is the gold standard. The gold standard for diagnosing CF is sweat chloride test. Also, pulmonary function test can be done to assess lung involvement in CF, okay? Stool test or stool analysis. This is done to check for fat malabsorption. You remember I said you will see stearia in patients with CF, which is fatty, foul-smelling stool. Lastly, genetic testing can be done for the identification of CFTR mutations. Finally, let's go to nursing care for CF patients. First, continuous monitoring of the lung sounds. Monitor for wheezing, rhonchi or rhonchi, crackles, because all of this can indicate that there is mucus plugging in the lungs, and this will impair the airway or gas exchange. So that can lead to difficulty breathing for your patient. So monitor lung sounds. Next, monitor oxygen saturation and signs of respiratory distress, such as dyspnea, use of accessory muscle to breathe. These are signs of respiratory distress, and also monitor their O2 sat. So do not forget to monitor their electrolytes, because there is risk of electrolyte imbalance. Remember, I said one of the signs and symptoms, one of the signs you will see in CF patients is salty, tasty skin. So they're losing a lot of salt through sweating. So that can lead to risk of hyponatremia, lead to electrolyte imbalance. Monitor their bowel sound. Hypo or hyperactive bowel sound may suggest or indicate obstruction due to the thick, sticky mucus in the intestine or in the bowel. And lastly, lung transplants may be needed in end-stage cystic fibrosis. Okay, guys, I hope you've learned a lot. Thanks for staying till the end. Bye.